Boosters, yes or no? For everyone, yes or no? As always, I have with me Dr. Naresh Trehan, head of Medanta, expert, been looking at the pandemic with a sharp eye. So, what is your recommendation for boosters? India's still not there below 60, but there are other countries across the world who have even given a fourth dose to its citizens.
So, I will say it from my clinical point of view because of the fact that what we see on the ground. Medanta is one of the major centers which treated the sickest of the lot. So people do come to us if they are testing positive. So what we are noticing on the ground level, it's not like a very large group, but we on a daily basis what we are seeing is people who have not been boosted in the older age group with comorbidities, when they get infection, they still get a worse kind of thing, in the sense their illness is longer. The ones who have been boosted, their illness is very short, in the sense 4 days. So our clinical observation is, and it's by no means a scientific proof right now, but speaking from that, while the people are exposed, we should boost them 6 to 9 months after they have been vaccinated with their second dose. Okay, because we also notice that the antibody count goes down. Now, if this is one of the indicators that we are using, I mean, nobody knows the absolute truth about antibodies, but we do believe that vaccine stimulates the antibodies to actually develop. So we have noticed that with 6 months on, the antibodies take a nosedive. And if antibodies indirectly are a protection, then a booster will help, and it also does boost the number of antibodies circulating. So I think from clinical observation, I would say yes, boosting should be done somewhere between 6 to 9 months. First, of course, especially people who are above 60 and like the government has said, but I think even people below 60 who, in graduated manner, who are exposed a lot, should be boosted if they like to take it.
That's also, sir, for those below 60 but with comorbidities. You see, diabetes, hypertension, heart disease has actually become a problem not just for the 60 plus but also for those who are in the ages of above 30 or above 40.
Right, of course, they deserve. To begin with, anybody with comorbidities should be protected because the outcomes are not as good with people who have comorbidities than the ones who are healthy and are devoid of any other chronic disease.
And so also children's vaccination. We've started 12 and above, but what about 12 and below?
So, with children, you've got to be a little more careful that the vaccines that are available to us, that their scientific data has to be scrutinized properly, and there is such a thing as post-approval, emergency approval, that you must do post-market study, because that will tell you whether there are complications happening in a larger group. Because when you do clinical trials, you do it in a limited group. But when you have few thousand people vaccinated, children vaccinated, and you do real-time tracking, you'll find out if there are any problems. So that's why children will be more careful, because there is data that pops up from time to time from overseas that the mRNA vaccine has stimulated cardiomyopathy, inflammation in the myocardium, myocarditis. All these things have surfaced in small numbers. But when a larger population is vaccinated, we'll really understand what is the percentage. Is it minuscule, and does it override? If it is so small that it overrides the risk of getting the disease and then suffering from it, then it becomes justified. So we are waiting for that data to be established to say, yes, every child should be vaccinated.
So just last question, what about the XE recombinant that has now come? UK has seen about 600 odd cases with this particular sublineage, as it's being called. Any concerns for India at the moment?
There is always a concern, no question about that, because we don't understand it. It's like saying when Omicron was discovered in South Africa, is it going to affect us? It did affect us in the sense it went up to numbers were 200,000. Now, you know, we are taking some consolation in the fact that it is not as severe as Delta, which is a good thing. So it's minor, it's mild, but people who have suffered it have the lingering effects of it. So it's not like you should invite getting the infection because you want to be careless and you want to invite it. So minimum amount of safety should be taken care of. So you're going into a crowded place which is not well ventilated, and there are people are packed together, must wear a mask, even now. Okay? And take baby steps towards opening up, not throw caution to the wind. Okay? All right.
Thank you so much for speaking to us with Abhishek Singh. This is Milan Sharma for India Today.